the YouTube channel Godless Geezer has brought to my attention and everyone else's the fact that there's a new chick tract out. And I know you expect lies and bullshit from chick tracts, but this is a different kind of lie. This one claims that there's a plot afoot to let all gay people donate blood to the blood supply so that we'll all get blood donations, blood transfusions will be polluted with HIV. Needless to say, this is not true. I'll try to go over some facts behind this and show you what the truth is behind this claim, but it is, of course, complete bullshit, and I thank Godless Geezer. If I can't thank God, I'll thank Godless Geezer for bringing this to our attention. In the second page of this tract, it states, if research money for AIDS is not coming at a certain level by a certain date, all gay males should give blood. Whatever is required to get national attention is valid. If that includes blood terrorism, so be it. Blood terrorism apparently meaning we're going to let those gay men give blood. Okay, man, they're threatening to infect our nation's blood supply with AIDS. That's cold-blooded murder. And this, of course, is referenced to an AIDS video by Jeremiah Films, which I'm sure is a completely scientifically accurate depiction of AIDS and this issue. Now, the American Association of Blood Banks, AABB.org, still does refer to the criteria of who is allowed to donate blood. MSM, which means men who have sex with other men, is still listed as a risk factor. And it should be, just like intravenous drug users, people who have sex for drugs or money, etc. These are risk factors, and they are not allowed to donate blood. The FDA has changed their recommendation to say that men who have had sex with other men are not allowed to donate. That has been an indefinite deferral, but they're changing it to a 12-month blood donor deferral since the last MSM contact, or since the last time that this man, would-be donor, has had sex with another man. That is the change that has created this and other people being hysterical about the notion of gays donating blood. I have to state there are legitimate concerns. It is simply not true that blood screening tests are 100% accurate. It is very unlikely. It's like 1 in several million of chances that you would get an infection from a blood donation from anything that they have a test for. There are many things they haven't had tests for. At the time when I worked in the medical diagnostic business, there were some things like Chagas disease and, of course, West Nile and so forth they didn't have back then. But it is possible to get a blood transfusion that has an infection in it. In the immunoassay instruments like the one I used to work for, the Abbott Labs PRISM instrument, this blood-sucking robot that's used at the time was pretty well considered the standard. All of the large regional blood banks around the world used that particular instrument for HIV and a number of other tests. And it's an immunoassay instrument. It takes about 7 to 10 days, occasionally longer, from the time you contract a disease to the time it can be detected in your blood. You have to get the immune response in your blood, and an immune response, an immunoassay instrument picks up the immune response in your blood. And it is why you do not want HIV high-risk individuals donating blood. And that's something that is determined not by political correctness, it's not determined by the hysteria of the religious right, it is determined by the numbers, the actual factual numbers of who is more likely to have this infection, and the simple fact that tests, whether they be DNA tests. At the time I ceased being a productive member of society and left my job there and became a retiree, they were working on DNA tests that could detect HIV at a much earlier state. I don't know if that's on the market now. I do know it takes years to get blood screening test on the market. But it's a necessary criteria, but that's not what the change is. The change is they're going from an indefinite suspension of allowing someone who has had sex with another man to having a 1-year waiting period, which is extremely safe. You are not going to have HIV undetectable in your blood after 12 months. So this scare tactic by chick tracts is just idiotic, and people should not worry about contracting this disease from blood donations. It is one of several million your chances of contracting something in a blood donation, and that will remain being the case long after blood banks around the world start making this change. Doesn't that look like John Hinckley and Clark Gable? And I know that's got to be Marlena Dietrich in this panel.